A very good morning to everyone. At the very outset, I congratulate the organizing team headed by Dr. Vitul Gupta for organizing this annual mega academic event, especially during the COVID times. Now, we all know blood pressure measurement, hypertension. This is an issue everywhere. It's an issue at our home, it's an issue at our workplace, and of course, it's an issue in the hospital. And you know hypertension, how common it is. And the accurate blood pressure measurement, and even more importantly, blood pressure monitoring, they are the precursors for management of hypertension. So today, in the next few minutes, we'll go through an overview of one of the important methods of blood pressure monitoring, that is ambulatory blood pressure monitoring. And we'll go through the following headings: introduction, what is blood pressure, hypertension, something about ambulatory blood pressure monitoring, the method, the various terminologies which are used during the ambulatory BP monitoring, what's diurnal rhythm of blood pressure, the blood pressure variability, what is the clinical utility of ambulatory BP monitoring, and some of the supportive clinical studies. Now, for almost 100 years from now, we know that high blood pressure is an important risk factor for not only cardiovascular disease, brain disease, renal disease, and it has been seen with our experience and clinical trials that with lifestyle modification and drug treatment, we are optimally able to control the blood pressure. This is the reason that now the measurement and monitoring of blood pressure has become a part and parcel of general health screening. So this is the importance. And just this, look at this slide, it tells you the importance of hypertension. At least 1 out of every 5 adult Indians at least suffers from hypertension. And it is responsible for around 55 to 60% of stroke deaths and around 25% of coronary heart disease if we consider our country. Now this slide shows us the association of various risk factors which are mentioned on the left side, and the bar, colored bar, shows us the various diseases which these risk factors are associated with. So at the top slot, we have the systolic blood pressure. So high systolic blood pressure is causing a major chunk, see the blue color, of cardiovascular diseases. So this is the importance of blood pressure, its measurement, its monitoring, and its control. The blood pressure, you know, is the lateral force generated by the moving column of blood on the vessel wall. We all know about this. And generally, as per the JNC8 classification of blood pressure, the normal is systolic less than 120, diastolic less than 80. Pre-hypertension is systolic 120 to 139, diastolic 80 to 89. Stage 1 hypertension is systolic 140 to 159 and diastolic 90 to 99. And anything more than 160 systolic or 100 diastolic is considered as stage 2 hypertension. Now, in addition to the JNC8 classification, we have some other criteria also which help us in staging the hypertension. That is, for example, the ACCHA guidelines. Then we have the ESC-ESH guidelines. There is some difference in the values as far as the staging is concerned. Now, blood pressure monitoring, you know, accurate blood pressure monitoring is essential for the diagnosis, treatment, and monitoring of hypertension. Now, routinely what is done is in-office BP measurement, that is in the physician's chamber, in the clinic, the measurement of blood pressure. But the point here is, the question important here is it a true BP? Is this recording a true blood pressure reading? What is a true blood pressure? it is defined as the mean level of various readings over a prolonged period. So what we should focus, what we have to focus on is the true BP monitoring rather than a single in-office chamber measurement. Why? Because we have to focus on the true blood pressure. Now, two techniques have been developed to improve the estimates of true blood pressure. Now, let's forget about the office and clinic BP monitoring. Other than that, let's focus on the other methods. Out of the office BP monitoring is a very important area of BP measurement and monitoring, especially when we talk of true BP. And we have two methods for this out of the office BP measurement. One is ambulatory BP monitoring, and second is the home BP monitoring. Now, out of these, now we'll focus on the ambulatory BP monitoring. The method, this is a subject has been shown in this slide, was been put on the ambulatory BP monitoring. What it consists of? It's nothing. This is a simple instrument, lightweight, portable one, which consists of a cuff and a monitor, lightweight monitor, and both the cuff and the monitor, they are joined together with the tubing. It records the blood pressure over the next 24-hour period. And it is programmed so that the readings are recorded every 15 to 30 minutes throughout the day, that is throughout the next 24 hours. And then after this 24-hour period, the entire data is put into the analysis by a computer. But what is more important? More important is validation of these readings. So that means this equipment instrument has to be validated as per internationally accepted validation protocols. And the most commonly and the most popular validation protocol is the International Protocol of the European Society of Hypertension. Now, this table shows the European Society of Hypertension recommendations for evaluation of the ambulatory BP monitoring data. Now, this is the information which we draw out of the ambulatory BP monitoring. Three types of information we draw. Number one is the diurnal variation, diurnal rhythm of BP. Second is the mean daytime and mean nighttime BP estimates levels. And third is the blood pressure variability. Let's focus on each one of them. The mean blood pressure. What is mean blood pressure? It is the average blood pressure throughout the recording. Daytime mean is the average of daytime recording. And nighttime mean is the average blood pressure of the nighttime records. These are some of the terminologies, parameters, which are used in the ambulatory BP monitoring. That is standard deviation, percent time elevation, hyperbaric impact, and the rate pressure product. Not diurnal rhythm. No, we know there are differences in the blood pressure measurement during awake and sleep period. So this diurnal rhythm describes the differences of mean blood pressure between the awake and the sleep period. We know the normal physiology shows us that during night time, there is a dipping in blood pressure by about 10 to 20%. This is normal, it dips. Now, what does ambulatory BP monitoring does? It helps us in classifying the patients into normal dippers, non-dippers, and then further, you might have a class of patients who are extreme or super dippers, and then reverse dippers. So that means you can have normal dipping, that is a fall in nocturnal blood pressure by 10 to 20%. Then you have non-dippers. The non-dippers is where the blood pressure doesn't fall nighttime. Now, this is not a good class of patients. Why? Because this is associated with adverse cardiac remodeling and LV dysfunction. Then you can have patients who are extreme or super dippers, where the dipping is more than 20%. And then another dangerous zone is the reverse dipper, where instead of BP falling during the night, is showing a rise. Now, it has been seen that this class of reverse dippers, it is associated with atherosclerotic processes, with maybe carotid plaques. So this is a very important entity, dipping, non-dipping, reverse dipping, which we come to know from ambulatory BP monitoring. Now, this slide just shows us the 24-hour BP variability. The blue color shows us the nocturnal BP dipping, and in the extreme right, we have the red color shows us the morning BP surge. Now, what is this morning BP surge? It represents the surge in the morning blood pressure. And what is this surge? How is this surge measured? It is the difference in the systolic blood pressure in the first 2 hours after awakening and the lowest level during the day. So the difference between the first 2 hours after awakening and the lowest level is the morning surge. And it has, we all know that in the morning there is a surge. But now another important point is, why do we measure this surge? It has been seen that each 10 millimeter mercury increase in the systolic morning BP surge increases the stroke risk by 20 to 25%. So this is the importance of surge. Next is the blood pressure variability. The blood pressure has a noticeable, reproducible pattern in the 24-hour circadian waveform, right? We all know there is a sharp rise in the BP during the early morning hours, that is between 4 to 8. And then steadily it has falls through the evening, so that the lowest degree, lowest value of the blood pressure is between midnight and 2 a.m., right? And then again after 2 a.m., say around after 4 a.m., again it starts rising. So this is the blood pressure variability. But remember, this has long-term effects. Now, this slide shows us the different types of blood pressure variability, starting from a very short-term blood pressure variability, that is variation from beat to beat. Then we have a short-term, then we have mid-term BP variability, then we have a long-term BP variability, and then we have a very long-term BP variability. And on the top, the slide top slot, red color, shows the various causes, etiopathogenesis of this different type of blood pressure variability. And the lower part of the slide, that's the green color, shows us the effect of this blood pressure variability on the various disease processes in the body in the form of cardiovascular, stroke, renal disease, glomerular filtration rate, proteinuria, etc., etc. Right? So this is the impact of blood pressure variability on the disease processes. Now, this slide again shows the short-term BP variability of systolic blood pressure. Hypertension. Hypertension can be a morning hypertension, shown in red, daytime hypertension, shown in green, could be nocturnal hypertension, shown in yellow. This can be depicted by the ambulatory blood pressure monitoring. And these on the top are the probable causes of this hypertension. Morning hypertension could be due to different causes. Daytime hypertension could be due to different causes like work stress, home stress, exercise, smoking, etc. Nocturnal could be due to obstructive sleep apnea, insomnia, diabetes, and so many other things. So this is, we can classify the patients as per ambulatory BP monitoring recording. Now, this is a very good slide. It shows, it compares the three methods of BP measurement and monitoring. The clinic measurement, then the home blood pressure monitoring, and the ambulatory BP monitoring. Now, out of these, we are more concerned with is ambulatory BP monitoring vis-a-vis home BP monitoring, because these are the two methods of BP monitoring which tells us about an estimate of the true BP, and it is out of the office BP measurement monitoring. So in the coming slides, I'll again focus on a head-on comparison between ambulatory BP monitoring and home BP monitoring. So What is the clinical utility of ambulatory BP monitoring? One, it helps us in identifying white coat hypertension. We know white coat hypertension. Very important. Patient is normotensive at home and shows a rise when enters the physician's chamber. Labile hypertension, resistant hypertension, masked hypertension, which is just opposite of the white coat hypertension, postural hypertension, hypotensive episodes, BP variability, and postural hypotension. So these are the different clinical utilities of ambulatory BP monitoring. Now this slide just depicts the various areas where the BP can be monitored, and in the center it shows how ambulatory blood pressure monitoring serves almost all the purposes and is a very good parameter. Now, this is a very important slide. This is the ACCHA recommendations for out of the clinic BP monitoring. That is, which are the subjects? So this is very important, please. Which are the subjects who should be put to ambulatory BP monitoring or home BP monitoring? Untreated systolic blood pressure, which is between 130 and 160, or diastolic between 80 and 100. So if you have a person who has systolic between 130, 160, or diastolic between 80, 100, but is yet to start treatment, is not on treatment. Now, these are the patients where we should focus on whether really these have hypertension or it is a white coat hypertension. So this group of subjects are the one who should be put to out of the office or out of the clinic BP monitoring by ambulatory or by home monitoring methods. These are again some of the other recommendations. Now, this is a flow chart to show the detection of white coat and masked hypertension. And these are the patients who are not on drug therapy. So ultimately, what the conclusion we draw is that once the patient undergoes ambulatory BP monitoring and is found to have white coat hypertension, this person should be put to lifestyle modification and should be put to an annual ambulatory BP monitoring or home BP monitoring. And on the other hand, if the person turns out to be masked hypertension, we again continue with the lifestyle modification and we start antihypertensive drugs. Similarly, this is the flow chart for white coat and masked hypertension in patients who are on drug therapy. So that means even when the patient is on drugs, the monitoring by ambulatory blood pressure monitoring helps us in proper management of these patients. Now, this is what we were discussing just now. Comparison of these two methods of out of the office BP monitoring, the ambulatory BP monitoring and the home BP monitoring. Now, I'll tell you the advantages of each. Now, as far as the ambulatory blood pressure monitoring is concerned, it has, now one thing is very common between the two. The common area between the two is that both ambulatory and the home monitoring, they help in diagnosing white coat hypertension and masked hypertension. This is common for both. Now, number one, what are the advantages of ambulatory BP monitoring over home BP monitoring? One advantage is that you see there is less chances of error. Why? Because if the in home BP monitoring, first of all, you have to train the patient how to record the BP accurately. So then that means there is a potential for some measurement error. This is one advantage of ambulatory. Second advantage is that nocturnal BP monitoring is better monitored with ambulatory as compared to the other method. Now let's come to the home BP monitoring. The advantage of home BP monitoring over ambulatory is, number one, you need not go to the physician's clinic. You need not visit the clinic. You can do it on your own. Number two, you don't have to spend anything. It is inexpensive. And third, that this home BP monitoring can be used over long periods to assess the day-to-day variability, right? So you can do it on your own as per your convenience. So this is the advantage of each of these two methods. Now, this is one study which showed the association of ambulatory blood pressure with all-cause cardiovascular mortality in hemodialysis patients. Now, this was a very recent study in JAPI, which regarding the clinical utility of ambulatory blood pressure monitoring. And this study showed that the ambulatory blood pressure monitoring is not only good for accurate diagnosis of hypertension, but also for assessing the various parameters of blood pressure. Now, this is even more important. Not only the accurate diagnosis, but all the parameters associated with blood pressure is very well depicted by the ambulatory blood pressure monitoring. Again, this is a very recent study which was published regarding the ambulatory blood pressure monitoring and diagnosing and management of hypertension. And it shows that how ambulatory BP monitoring established, and it has been recommended as the method of choice for the assessment of blood pressure and for the rational use of antihypertensive drugs. So this is another important study. So, dear colleagues, to conclude, I would say that ambulatory blood pressure monitoring is an optimal tool for recording a true blood pressure, to have as good estimate of a true blood pressure. Number one. Number two, it is very useful to diagnose masked hypertension and white coat hypertension. Number three, it carries an advantage of evaluating blood pressure variability. Another important aspect is it identifies normal dippers from non-dippers and reverse dippers, which are the independent risk factors. Hence, an optimal utilization of ambulatory blood pressure monitoring should be made for the blood pressure monitoring. Thank you. Thank you so much for your patient listening.